It's often called a silent killer, yet prostate cancer remains one of the most common and most deadly cancers for men in America. Here now to help us better understand this Prostate Cancer Awareness Month is Dr. Kennard Hood from the Emory University School of Medicine. Dr. Hood, welcome to the show.
Thank you. I appreciate it, Chesley.
All right. Why is this called the silent killer?
Well, a lot of men just don't know they have prostate cancer. You know, we hear people talk about it and we hear that our neighbors and our coworkers have it, but you know, we're not sure exactly what the symptoms are, and men aren't great at finding out about their health and what to look for.
Is that we just don't go to the doctor to find out what these early warning signs are? I mean, what should we be looking for?
Well, exactly. You know, I always like to say that men, we have a man problem. And the man problem is that we don't like going to the doctor. We don't want our cholesterol checked, blood pressure checked. We don't want any of it done. And so that's why it's so important that we have this done. So the symptoms you want to look for are problems urinating, a slow stream, difficulty getting your stream going. Also, sometimes frequent urination can be a problem, or dribbling, or blood in the urine. So these are all symptoms that, you know, you really need to have checked out.
How does prostate cancer symptoms that you just mentioned differ from other less serious conditions that men may just dismiss this over?
Well, the great question, and the reason why is because there is something called BPH, benign prostate hypertrophy. It's an enlargement of the prostate that almost all men get as they age, and oftentimes the symptoms are identical, and that's why it's important that when you see your doctor, get the blood test, a PSA blood test, to check to see if it's elevated, and do more tests need to be done.
Something more important to you and I, it's higher risk amongst black men. Is that a biological component or something else?
It is. That's a genetic component that black men have. So even people of black ancestry from the Caribbean, same thing. Black men in America, same risk. As a matter of fact, it's so high that black men are 2.5 times more likely to die from prostate cancer than their white counterparts. And, you know, nationally, the rate for getting cancer in the prostate is 1 in 8 for all men, but in black men, it's 1 in 5.
Is it important to know your family history? Is that part of the issue for us?
Yeah, many people don't want to talk about their medical problems. They don't want to talk about their urination and if they had prostate problems or prostate cancer. So we just don't know.
My father passed away. I was only 9 years old at the time. My grandfather before him. So I don't know how far back I should go. Well, in my case, what do I do?
So the most important people are what we call first-degree relatives. So that includes your father, your brother, and also your son. So if you have an older adult son who, let's say, is over 40 and they develop prostate cancer, you might be in your 60s. But that also tells you that you may have a genetic predisposition to prostate cancer, so you need to get checked out too.
Yeah. How much of a stigma or a lack of awareness in the community plays a role in late detection?
Oh, that's a huge role because, you know, we know that prostate cancer is 95% or more curable if you detect it early. It's one of the most curable cancers there is. And so one thing we've done at Emory, we're rolling out this prostate cancer mobile unit sponsored by Arthur Blank Foundation starting this month. And you're going to see us in communities around Metro Atlanta and North Georgia.
All right. And so give me the particulars before I let you go. Like what age should we start getting checked and how often we should get checked? Give me all those.
All right, we're encouraging men to come up. If you see the big blue bus, come up and have your PSA checked, because if you're over 40 and you have a family history, and you need to have that checked. Also, the PSA test is free, and we do it the new way through your blood, not the old-fashioned way that everybody hates. So when you get on the bus, you only have to have blood drawn.
That's it, right? Is that becoming now the thing? Because I know there's still some doctors out there that do it the old-fashioned way.
Yeah, I mean, if you think about it, men are afraid to have that part of the exam done, so they don't want to go to the doctor at all. They don't get their blood pressure checked, nothing, because they haven't gone in years. I'm not having that done.
Gotcha. Dr. Kennard Hood, thanks so much for your insight. Thank you for what you're doing for our community and keeping us healthy, okay?